Two different areas of the Affordable Care Act took effect as of August 1st. Here to discuss what they are and the impacts to Minnesotans, we have Representative Erin Murphy. Thank you for joining us today.
Thank you for having me.
Representative Murphy, let's begin with something that a lot of people are starting to see in their mailboxes. They're getting rebate checks from their insurance companies. It has to do with something called the 80-20 rule. Can you explain a bit further what that means?
Sure, I would be happy to. The Affordable Care Act is being implemented over a series of years, and two key provisions came into effect on August 1st. The medical loss ratio was championed by Senator Franken, and he was concerned that with the implementation of an individual mandate requiring Americans to purchase insurance, that we would want to make sure that insurance held as much value for Americans as possible. So he fought very hard for the 80-20 rule, which says that 80% of the premiums that people pay to health insurers must be spent on health care, and not things like executive salaries and marketing. And he was successful with that, and that piece of the law is being implemented now. So Minnesotans and Americans are going to start to see the result of the 80-20 rule in the form of rebates or lower premiums for their insurance. So insurance companies have to look at the amount of money that their premium dollars are being spent on healthcare, and they have to adjust to meet that rule. And if they have exceeded that 80-20 rule, they have to refund that excess back to the premium holders, the premium payers.
And some people are already receiving that money. When can others expect it? I'm sure there are a lot of questions out there on whether or not they will see an actual check or see the impact in their premiums.
You know, the law is in effect now. I think some insurance companies across the country, anticipating the law, adjusted their premiums for premium payers rather than pay back a rebate. In Minnesota, Health Partners is paying out rebates. And I think the best way for an individual to know is to call their insurance carrier directly to find out how they're implementing the 80-20 rule. Senator Franken's office estimates that about $9 million will be returned to Minnesotans. It'll be going to about 123 Minnesota families, and families should anticipate about $161.
123 Minnesota families?
123,000.
Okay.
Thank you.
You're welcome.
And they should each anticipate a check roughly around $161 as a return to make sure, again, that the insurance companies aren't experiencing a windfall, and they're being held accountable to make sure that premium dollars are being spent on health care and not on ancillary things.
And let's move on to the second component that just took effect, the Women's Preventive Health Amendment. It ensures that women have access to cancer screenings, wellness visits, contraception and prenatal care, and counseling for domestic and interpersonal violence. Now, under this provision, all health plans must cover preventative services without copays, deductibles, or other cost sharing. So here's a question that I have when I was reading this. What about men? And are they covered as fully as they should be too? And then we can talk about the benefits to women, of course, but I'm just curious about men in this scenario.
It's a fine question. I think that there are a number of conditions that impact women that have not necessarily been covered by insurance, right? So there's a book of preventative and wellness checks that apply to both genders, but women have been paying extra for things like mammograms and screenings that both serve a preventative nature, and they also serve to detect diseases early so they can be treated early. So I think this law is bringing into parity the coverage for women and men. So rather than think that men are being excluded somehow, I think of it as women who have been paying extra for some of these basic services are now getting them covered with their health care dollar.
Okay, I'd like to talk a little bit about the Health Insurance Exchange before we run out of time. It's currently being developed here in Minnesota. You're a proponent. Do you think that the task force can and will have its recommendations by the end of this year as mandated by the federal government?
I think that they will have recommendations prepared to meet that deadline, and I think they have to get something sent to the federal government by November, by the middle of November, and I think they're working toward that goal.
What would you like to see in it?
Well, you know, I am a proponent of an exchange, and it took me a little while really to understand the value of an exchange. We debated it in Minnesota in 2007 and 2008. It didn't become law in Minnesota, but with that study I became a proponent. I think an exchange allows for easier purchasing of insurance for Minnesotans. It creates a standardized marketplace. where people know what they're getting for their dollar, and I think that's pretty important. I want to make sure that an exchange in Minnesota has good consumer protection in it, so people are knowing what they're buying. And I also think it would be really smart to make sure that the exchange works with our public programs in an efficient manner, so a Minnesotan can come to an exchange and find out they can purchase in the exchange, or they could go into medical assistance if that was a better fit for them. One-stop shopping for Minnesotans, I think that's really important.
The November election, of course, could alter this healthcare landscape once again altogether. So if President Obama is not reelected, do you see any elements of this Affordable Care Act surviving?
I do. I think, it is much harder to repeal the law than some are suggesting. But mostly, I think, Minnesotans and Americans, with the Supreme Court ruling and the Supreme Court upholding the constitutionality of the law, are ready to move on and ready to move forward with the implementation. So I hope that the candidates running for the U.S. Senate and for the presidency are listening carefully. There's a lot of talk about repealing. There's not a lot of talk coming out of Governor Romney about what he would do to replace the Affordable Care Act, and that's a big concern for me. So I think it is important that we understand where the Affordable Care Act is going to take us, and we continue to move in that direction.
And there are so many different elements included in this Affordable Care Act. Is there anything that I left out that you would like to point out to Minnesotans?
Well, I think for the first time in our nation's history, Minnesotans and Americans are going to have access to coverage. And while coverage is not the be-all and end-all for health care, without coverage, you're not going to get access to the care that you need when you're sick. There's finally a promise in America that people will have coverage and they can get the care that they need when they're sick, and that's a pretty important step forward. So I would hate to lose that. I would hate to go back to the status quo system where sick people are often shut out of the system. That would be real unfortunate.
Representative Erin Murphy, thank you so much for coming in to discuss this very intricate topic. We really appreciate it.
Thanks for having me. It's always good to see you.